the 25th of November 2020. Just a few weeks to go before the end of the month, and then it is December. December, boss. Yeah, whoa. Yeah, but I've been told that you can't say December if you don't have 50K in your account just lying around to have fun, to say December. And yeah. Anyways, I'm going to mind my own business right now. In fact, we are going to move on to yeah, we're going to move on to Dr. Nqobile Sithole to talk about peptic ulcers. She is currently on the line right now. If you have been having terrible stomach aches and unexplainable, you have no idea where you got them or how you got them, you might be suffering from peptic ulcer, especially after having eaten a certain food. Um, like some people, tomatoes affect them. Yeah, I know. But anyways, Dr. Nqobile is on the line to tell us more. Hi, Dr. Nqobile.
Good afternoon. How are you?
Good, thanks, and yourself?
I'm well, thank you.
So, doctor, what is a peptic ulcer?
A peptic ulcer can be an erosion in the lining of the stomach.
Mm.
It can come in different grades. You get what we refer to as gastritis, where there's just irritation in the lining of the stomach. That can actually present quite, with painful, predominantly epigastric pain. That is relieved with certain foods or made worse with certain foods.
Mm.
Or there can be an open ulcer which can even bleed.
Mm.
So somebody may present with that type of pain in the epigastric area, but that pain can be accompanied by nausea and vomiting, and sometimes they can vomit black stuff, which is blood that has been mixed with the stomach acid, or it could even be frank or fresh blood when the ulcer is actually bleeding and they vomit the actual blood that's coming from the bleeding ulcer.
Mm-hmm. Now, what are the symptoms of these ulcers? I mean, the peptic ulcer.
Symptoms of peptic ulcers is, like I've said, it can be precipitated by certain foods. So if one has had a spicy meal or something that's got, say, chilies, things like alcohol, smoking can trigger the ulcers. So they may present with epigastric pain. Sometimes it can be so severe that it is confused for a heart attack.
Mm.
So it means they may be sweating, pale. They may even collapse with the pain. So it can be varying degrees of pain. But any pain that is relieved by dairy products, things like milk, mass, yogurt, is typical of ulcer pain.
Mm-hmm. Now, can a person develop a peptic ulcer at any time during their life?
Yes, it can develop at any time during their life, and there is no, distinct scientific cause for peptic ulcers. Stress is even linked to peptic ulcers and chronic illnesses. People that are ill or that are on certain medication can develop peptic ulcers as well. Those we refer to as stress ulcers.
Mm-hmm. And who are most at risk of getting this peptic ulcer?
It's mostly people with chronic diseases, people that love spicy food or even chili food in their diet. And it's also like people that, in fact, skipping breakfast has been, linked to peptic ulcers as well, or skipping meals rather, because the stomach stays for long and it's empty and it's producing acid. And as a result, you find that the acid is actually, digging into the stomach. There's a lot of other scientific interactions that take place. There is actually a bug that's in the stomach, which is referred to as the H. pylori, which is responsible for the stomach ulcers. And it has been identified where people have had an endoscopy done, and the doctor does a biopsy where they take microscopic material from the ulcer itself just to see what it looks like under the microscopy.
Yeah. Yeah, no, that sounds quite scary, especially knowing that we love spicy food, so we can develop an ulcer at any time. But now we do fast, and also intermittent fasting as well. And because of the fasting, we are without food for some time. Does that
Yeah.
affect, and could we be likely to get a peptic ulcer?
Yes, in fact, like I said, starvation or fasting even can actually predispose one to stomach ulcers because of the length of emptying of the stomach. So the acid that's in the stomach, the acid built up can actually, instead, because the aim of that acid is to digest whatever food that comes into the stomach.
Mm.
So the body is naturally programmed that at least every 7 to 8 hours one would be having a meal. So you can imagine if you are going for like days or even weeks without having anything.
Mm.
So that acid build up or that excess acid can actually become harmful to the lining of the stomach.
Hmm. And how is it diagnosed?
Importantly, it is a clinical diagnosis. So when you go to a doctor, they can be able to make that diagnosis. And obviously, if they want to have, evidence, then we look at an endoscopy. An endoscopy can be done at an outpatient. There are doctors that do outpatient scopes, and they can see inside the stomach. They actually put a camera. You go under sedation. Sedation is where they put you to like light sleep. You're not like fully, anesthetized.
Hmm.
You can still breathe and you can still, you can still control your airway. But so that because the procedure can be very uncomfortable because you are asked to swallow a camera.
Mm.
It's a small tube. It's like, like the feeding tube.
Yeah.
So that camera is just as the tube of that camera is as small as the feeding tube. But at the end of that tube is a camera that is going to see inside the stomach, and that's when they can be able to diagnose stomach ulcers. That actually can be used for treatment of ulcers as well because they can inject into the ulcer as the doctor is seeing it on the camera. They can see if it's, some ulcers unfortunately can be cancerous as well. So if it looks cancerous to the doctor or if it looks even suspicious, they can take a piece of that ulcer and send it to the laboratory just to exclude things like cancer of the stomach.
Hmm. Now, are there different types of ulcers? How can you tell the differences if there are?
Uh, Predominantly, like I said to you, it just depends on the varying degree.
Mm.
That's when it's more for clinical purposes. So if it's penetrating, in fact, when the doctor does the scope, they can see how severe the ulcer is. So in terms of its severity or how deep the ulcer is into the lining of the stomach, because you can get an ulcer that's affecting the full thickness of the intestine. And that's where, in those instances, we find that, oh no, the relative was rushed to theater. Because then, obviously, it means even if they were to go on treatment, it wouldn't help because the ulcer is so deep into the lining of the stomach that it affects the full lining either of the stomach or of the intestine. As a result, the doctor needs to resect that area and stitch it up because otherwise one would bleed to death. And unfortunately, that's where we lose some people because they feel that pain and they'll take the Gaviscon and think, oh no, it's just
Mm.
because the pain disappears. And eventually you find that the person is bleeding internally and they may even die of the
Sure.
internal bleeding. So it's important not to just treat, not to just treat yourself at home just because you have a long-term history of
Mm.
ulcers that you know what usually helps you because you may not know the severity of the ulcers. And I would also recommend that at some point in time you do a scope just so that the doctor can see whether it's anything serious or if it's just a gastritis that can be treated with some antibiotics and some antacids
Mm.
only.
Mhm. And yeah, you already mentioned that you can treat it with antibiotics and acid. Are there any other ways of treating it? Will you need to go for surgery to have it removed or repaired? How does it go? How does it work?
Yeah, importantly, if it's a bleeding ulcer, that would definitely need to be repaired surgically. So you will be booked in for theater, and you will have either a laparotomy. And nowadays, there's actually even better treatment methods where they still operate, but they do what is called a laparoscopy, where laparoscopic surgery, basically the doctor will just do small pokes or small holes, like 3 holes or 4 maximum holes, which are about a centimeter. And they put all the equipment, camera, including scissors and stitches through that laparoscope, and they can stitch the ulcers up.
Mm-hmm. All right. Very interesting here. And we are coming to the festive season, and people are going to be enjoying themselves and focusing on not focusing rather on their health. And the things like ulcers, it's true, we overlook them. We would treat them as we would just pop our Gaviscon and other antacids and good to go with the rest of our lives. But like you mentioned, it could be life threatening if it's a big problem inside and you don't know it, and you're making it worse by just contributing to it with your unhealthy lifestyle. Wow. All right, Dr. Nqobile, thank you so much for your time.
Okay, thank you for having me.
Have a wonderful.
Bye.
Oh, sorry, Dr. Don. All right, so that was a Dr. Nqobile Sithole, and I forgot to get her contact details again. Ah, guys, please bear with me. Yeah, it is Wednesday, and I don't feel so great. I've been telling you guys about this since yesterday. I think I'm coming down with the flu or something. Yeah. But anyways, that was Dr. Nqobile Sithole talking about peptic ulcers, and you must make sure that you go and get yourself checked out if you are feeling some sort of pain, sharp pain like this year, with symptoms of sweating, and you'll know. I mean, it's your body. You'll know that something just doesn't feel right. Go to the doctor, get yourself checked. You might have a peptic ulcer. And if you do not get treated for it, you could bleed. Internal bleeding could lead to death, and God forbid. Anyways, do stay with us. We will be back after the break.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
If you ask me, why do I stand here so unafraid of everything around me? Proudly I would say, I am a Muslim. If you ask her, why does she dress that way, all covered up, in a world that gives it all away? Proudly she would say, I am a Muslim.
Today's topic is peptic ulcer. Peptic ulcers are sores that develop in the lining of the stomach, the lower esophagus, or small intestine. There are 3 different types of peptic ulcers. They include gastric ulcers that occur on the inside of the stomach, esophageal ulcers that develop inside the esophagus, duodenal ulcers that occur in the upper and first part of the small intestine, known as the duodenum. Peptic ulcers are present in around 4% of the population. Peptic ulcers may result in complications, such as internal bleeding, perforation, and blockage of the stomach. Bleeding occurs in as many as 15% of people with the condition. Causes. A peptic ulcer occurs when the inner surface of the digestive tract is eroded by the acidic juices that the cell of the stomach lining secretes. The digestive tract is coated with a mucus layer that normally protects against acid. An increase in the amount of acid or decrease in the amount of mucus can create a painful open sore. The major causes are Helicobacter pylori, or H. pylori, a bacteria that lives in the mucus layer that covers and protects the tissues lining the stomach and small intestine. This bacteria often causes no problem. But in others, it can raise the amount of acid, break down the protective mucus layer, and irritate the digestive tract, producing an ulcer. The bacteria is transmitted from one person to another by close contacts, such as kissing, and also through unclean food and water. Frequent use of certain pain relievers, such as aspirin and other NSAIDs, such as ibuprofen, Advil, Motrin, and others, naproxen sodium, as in Aleve, Anaprox, and others, ketoprofen. Another type of pain meds, like acetaminophen, will not lead to peptic ulcers. Risk factors associated with the conditions are smoking, drinking too much alcohol, upper abdominal radiotherapy, liver cirrhosis, Crohn's disease. Eating a lot of spicy food and stress does not cause peptic ulcers, but they can aggravate symptoms. Symptoms: burning abdominal pain, heartburn, nausea, fatty food intolerance, bloating or abdominal fullness, bloody or dark stool, changes in appetite, unintended weight loss, vomiting of blood. Diagnosis. To make a diagnosis, the doctor may first take a medical history and perform a physical examination. The doctor will check for bloating in the belly and pain. To know for sure if there is an ulcer, the doctor may carry out an upper endoscopy. In this procedure, the doctor inserts a long tube with a camera down your throat and into the stomach and small intestine to examine your digestive system and look for an ulcer. If an ulcer is detected, the small tissue is removed for examination in the laboratory. An upper gastrointestinal series, also called a barium swallow, may also be carried out. For this procedure, you will be required to drink a thick liquid called barium. This liquid will coat your digestive tracts and make it possible for the doctor to view and treat your ulcer. The doctor may recommend breath, stool, or blood test to determine if the H. pylori bacteria are present in your stomach. This is done because the bacteria is a cause of peptic ulcer. Treatment. Treatment depends on the cause of the ulcer. Treatment will involve killing the bacteria, reducing the use of NSAIDs, and helping the ulcer heal. If the bacteria are present, the doctor will prescribe a combination of antibiotic medications to kill them. These may include tinidazole, like Tindamax, amoxicillin, like Amoxil, clarithromycin, like Biaxin, and others. Proton pump inhibitors, or PPIs, medications to block stomach acid, acid blockers, such as ranitidine or Zantac, famotidine, like Pepcid, to reduce the amount of stomach acid released into the digestive tract. Medications such as sucralfate or carafate to coat and protect the lining of the stomach and small intestine. Thank you for watching our video. Please do not forget to like and share the video. Also,
You are listening to Mkwanda live on Salam Media.